Lisa Schnedler, president of Upland Hills Health, and it's our 50th anniversary. It is time to celebrate. You know, when I was reflecting on what to say today to open this video, I remembered a conversation that we had just a few weeks ago. We had a group in here from Kansas City. They had never been here before, and they didn't know about Upland Hills Health. And so what they said is, tell us what Upland Hills Health is, what makes you different. And there were a number of us in the room around the table, and we got talking, and I would say it fell into three different categories. The first one is excellence. And what we were telling them is we have MEP, Madison Emergency Room physicians here, we have Madison pathologists, we have Madison radiologists, we have a whole plethora of people that you would see in Madison. But we also have our excellent employees who are local, well-trained, and lead with their heads and their excellence, and they're constantly updating their skills. So that was one bucket. The second bucket I would call kind of reassurance. And into that bucket, I will put the fact that we have high quality scores, high patient experience scores, and we've won awards all over. You know, we've won them for our STEMI program, we've won them for our patient experience program. We're in the top 100 critical access hospitals. So we know that we do a great job, but we give the reassurance to ourselves and to everyone in our community that what the care that we offer is excellent. But the third bucket I'm going to talk about, everybody professes, but I would say not everybody delivers. You know, in marketing, they always say under promise and over deliver. And I think that's exactly what we do. And that is the area of caring. I can honestly say in my 11 years of being here that no one cares for you like this team at Upland Hills Health. And that is a story that goes back to the sisters, to the General Hospital, that story of them coming together and serving this community. It's a story that continues today with all of you, and that is a story worth celebrating. So enjoy the video. I'll circle back with you. It is time to celebrate.
There is a legacy of care in our region that started 100 years ago when Sister Mary Benedict founded St. Joseph's Hospital. 20 years later, Dr. Warren W. Joslin opened a general hospital in Dodgeville. This year, we are celebrating the 50th anniversary of the merger of those two hospitals. That merger created Memorial Hospital of Iowa County, which later was renamed Upland Hills Health. There are many milestones that have laid the groundwork for where Upland Hills is today, but the true strength of this health system is found in the people who work here, employees who have shaped our reputation for caring, building trust, providing compassionate care, caring for others like they are family. What is the characteristic that all employees share at Upland Hills that make our hospital and clinical care special?
I think one of the qualities of individuals that work here at Upland Hills Health is that they care very deeply. These are the communities that they live in. These are the people they know, and they take great care of them, and they treat them very well. I think our customer service that we provide is exceptional.
And we stay.
We have been blessed here at Upland Hills Health because we have a lot of employees that have been here a very long time. And in today's world, that's not always common, but people work here a long time because they love caring for the people that they take care of, and they like the work they do.
We celebrate people like Tammy Persinger, our first employee to reach 45 years of service.
This is where was born, raised, went to school. I got friends, family. I worked at the front desk for 18 years, so you get a lot of that patient and staff relationships, you know. And I still see them. It's like a big family.
Working at Upland Hills Health is a family affair for many of our employees. For many Upland Hills staff, the hospital and clinics have played an important role in their family history. It is a coming home for many. Our employees make a difference in the lives of people living in our community.
Probably the most memorable moment that's very vivid in my memory is actually the resuscitation of one of my previous partners. It was a warm summer day many years ago where I came home from the farm and received an emergency phone call to come to the emergency room now. And apparently one of my partners, who had been a senior partner and mentor, was out at Governor Dodge State Park riding a bike and underwent a heart attack and an MI. and was cardiac arrest. So we met in the emergency room, and we had a very successful resuscitation, saved that individual at that point in time. And what solidified that memory for me was the way the community responded and came together. The administration was there, other partners were there at that time, the orthopedic surgeon was there at that time, anesthesiology came in at that time, which was absolutely amazing, that the surrounding support that arrived. And afterwards, I walked away and, of course, was sweating and worried and concerned. And got a phone call the next day from them in the Madison Hospital thanking us for everything we did for them. But the big part that came out of that was the way that the educational process in the area evolved in terms of understanding some of these chronic disease states and what can really happen, and the availability of all these services to respond to those.
Coming together for our friends, neighbors, and people we have never met, serving our amazing communities. This is a common thread and a special bond that makes Upland Hills special. We treat you like family. Traveling for care outside of the community where you live is a burden. For some, it is the difference between seeing a provider and postponing it. Dr. John Lehman, founder of the Montfort and Highland Clinics, started his practice in what was then an underserved community.
When I was in medical school, I was able to receive a scholarship through the Public Health Service, and they assisted me through medical school, but the requirement for that was to work in an underserved area year for year that they assisted me through school. And toward the end of my training, I was able to match with an underserved area, which turned out to be Highland, Wisconsin. And then later on, Dr. Breyer was planning a retirement in Montfort. And some of my patients actually were from Montfort, and I was very familiar with the community there, being involved with the church and other areas.
Keeping care local saves lives. Healthcare delivery changes. Technology improves. Utilization increases. Buildings and equipment become obsolete. Ryan Teasdale, Director of Facilities, explains.
The biggest building improvement I've seen in my time here has to be back in 2007 when we decided to move on from the old hospital, the 1949 building, and the old cafeteria, the 1917 boiler plant. Taking those down with the additions of the medical office building to the back and a new imaging building, a new ER at that time. That was a really transformational time frame for this campus and Upland Hills Health. Future projects for Upland Hills Health that I'm excited about that will definitely make an impact on the communities that they serve will be both the Mineral Point Clinic. That's a very significant clinic that we're putting in. It's going to be well used and a mainstay for Upland Hills Health. And also the Mount Horeb Clinic, when we're done with that project, with the addition of an urgent care for that community, these two new clinics are going to be staples for Upland Hills Health for years to come.
Upland Hills Health is important to not only those who work here, but it also becomes a special place of joy or healing for some. But we also are with people when they face a loss, and it can bring uncertainty for an organization too, as Lisa explains.
You know, as is true for an organization, a family, we've heard all of the good stories about Upland Hills Health, but there have been some difficult times in our history too. I reflect back when I look at the ledger that the sisters filled out when they were talking about how much money they were able to charge for different procedures. And there was an acronym that they used, and I can't tell you exactly what it was, but what it meant was, we will pray to God for money for this one. And there were a number of those entries where they just simply didn't get paid, and they really relied on their faith to get them through that. I think back to 1986, when this hospital declared bankruptcy. A lot of people put everything on the line to bring us back. And they did. And then I think about just recently, how we came through the pandemic. And you know, many people came to work and didn't know if they were going to catch a disease, a virus that they would not recover from. And yet they showed up. They showed up every day. And just as gold is refined by fire, I think that really talks about us as well. We have been through some difficult times together in the past 2 years. But you know what? We are better for it. It would be hard to think that I'd be saying that 2 years ago, but I see such caring, such commitment, such love for each other, for our patients in the community. I think the pandemic, now that it is behind us, we can say we are better having come through that as a team. We don't want to do that one again, but let's celebrate because you made a difference. You are Upland Hills Health.
Why does Pat Lindner volunteer here?
Because I like it. That's like it here, you know, and the people are friendly. Isn't it? Aren't we lucky to have such a great place in our town?
I think we can all be very proud that we're celebrating our 50th anniversary, and I know that all of my coworkers feel just as enthusiastic about our future. So happy 50th, Upland Hills Health, and I can't wait to see what's next.
Happy 50th, Upland Hills Health.
Happy anniversary, Upland Hills Health, and hopefully many, many more for me to be here and to provide services for this community.
Happy 50th, Upland Hills Health. Happy 50th, Upland Hills.
Personally, it's been an honor to be a part of an organization that has done so many good things and been so successful in comparison to a lot of facilities our size across the country that just have not seen the success, and it's because of the people. And so, you know, cheers to everybody and happy 50th for that reason.
Getting to work with the incredible, competent, caring, and compassionate people that work here, and they do incredible things for our community, and that's a big inspiration to me every day. And so you can go down the hall and see a sincere smile, and that inspires me as well. And so it's great to work here. They take on challenges that come, and one of the common things I'll hear sometimes, and just heard it the other day when there's bad weather, that's what we do. We fix things. And so that's why I like working here. I've never had a boring day here in my life. There's challenges from time to time, but the people here make things work out to an incredible end. Happy 50th anniversary, Upland Hills Health. And no, I have not been here all of those 50 years.
50 years, it's been 40 that I know of that I've worked with the gift shop, and it's gone by so fast, and I just have loved doing it. And if you asked me, I would do it all again. So congratulations to everybody, and thank you for all these nice people that we have here for being so great. We're really lucky.
Happy 50th, Upland Hills Health.
Happy 50th, Upland Hills Health. Happy 50th, Upland Hills.
Happy anniversary, Upland Hills Health. 2 thumbs up to the heroes who don't wear capes or armor.